Welcome to Wine Wednesday. Have you ever been told that you have a rotator cuff problem? Or maybe someone mentioned frozen shoulder. The challenge is that both conditions can cause shoulder pain, stiffness, difficulty reaching, and even trouble sleeping at night. But there are some similarities, and despite that fact, there are very different conditions. And knowing the difference can actually dramatically change the treatment approach. Tonight, we're going to talk about rotator cuff tear versus frozen shoulder and how you can tell them apart.
Okay, we'll start with rotator cuff tear. A rotator cuff tear involves a tear in one of the four tendons of the rotator cuff. The rotator cuff is four muscles that sit on your shoulder blade and attach to the humerus so that it can move. What we find is that people who have rotator cuff tears have difficulty raising their arms above their head. They complain of pain with that motion, with reaching behind their back, putting their arms straight out, lifting anything heavy, even nighttime discomfort, finding it difficult to find a comfortable position in which to sleep.
So what is frozen shoulder? Frozen shoulder is also known as adhesive capsulitis, and it is very different. Instead of it being a tendon problem, the frozen shoulder actually involves the joint capsule itself. The capsule surrounding the shoulder becomes thickened, tight, and restricted. I kind of think of the capsule like saran wrap, holding everything in. The result is a significant stiffness and loss of motion. So when somebody has a frozen shoulder, they usually are telling us, I can't reach overhead, I can't fasten my bra, I can't reach into the back seat of my car. The hallmark isn't just a symptom of pain, it's the loss of motion. And the shoulder simply won't move the way it used to.
There is a simple test to differentiate, although many other factors have to be looked at. But if you can move your arm and it's painful, it's probably a rotator cuff tear. If you can't move your arm and it's painful, it's probably joint capsule. They're not mutually exclusive, and sometimes we see them happen in tandem, but that's a good differentiator between a tear and frozen shoulder.
Oh, sorry. I was thinking about the MRIs.
Okay.
But the MRIs don't always give us the full answer. One of the biggest mistakes that people make is assuming that the MRI is going to provide all the answers, it's the be-all to end-all, and once I have that MRI, I'll know exactly what it is. But we frequently see patients that have had an MRI and it might say one thing, but actually something else is going on because it's not getting to the root cause of the problem. And the reality is that most people over the age of 40 or 50 probably have some type of rotator cuff tear, and they just don't have any symptoms of it. And so you're going to have the MRI, it's going to say that you have this rotator cuff tear when it might be a really insignificant rotator cuff tear, and it's actually something else that's going on. So it's more about your movement and your strength and your mobility and your function than it is what the MRI tells us.
We like to say that the MRI is a gold standard of imaging as we know it right now, but it's not the only thing that we need to look at when we're evaluating somebody's shoulder. What we want to do is find the root cause of the problem, as Tiffany alluded to. Now, when you've got shoulder pain, it may be the shoulder proper, it may be the rotator cuff, it may be adhesive capsulitis, but it may also be coming from your neck, whether you have a pinched nerve or some tension in your neck. So that those tensions that even affect the shoulder blade can affect how the shoulder moves. So we have to look at all of those things when we're evaluating somebody's shoulder so that we're not just focused on the quote-unquote rotator cuff tear. You might have a limitation in the ability to turn your head. You might have a limitation in thoracic spine rotation. Both of those affect how well your shoulder moves.
So how can you tell the difference between a frozen shoulder and a rotator cuff tear? The simple rule of thumb is that if it hurts when you move it, think rotator cuff, and if you simply can't move it, think more frozen shoulder. Not always the case, but those are just some general rules of thumb. Of course, there are exceptions. And if you are struggling with shoulder pain or stiffness or have any other questions, please don't hesitate to contact us. Comment shoulder below. Cheers.
Cheers.
Because we're Dr. Mike and Dr. Tiffany Kriz of Kriz Physical Therapy. and we're here to make sure that you move better, live better, and stay active for life. Thanks for watching.